This recording will go over migraine headaches. Migraine headache pain is usually described as throbbing and unilateral, affecting just one side of the head. Migraines can be accompanied by associated symptoms such as nausea or sensitivity to light, sound, or head movement, and can last for 4 to 72 hours. They are also associated with auras, which we'll talk about shortly. They tend to be familial, and women are affected more commonly than men. The cause of migraine headaches is not clear, but in general, experts suggest that migraines are a neurogenic process with secondary cerebral vasodilation followed by a sterile brain tissue inflammation. So the problems that's causing the headache are vasodilation and inflammation. As cerebral arteries dilate, prostaglandins, which are chemicals that cause inflammation and swelling, are released. Vasodilation in turn allows prostaglandins and other intravascular molecules to leak, contributing to widespread tissue swelling and the cessation of throbbing pain. Some patients have things that trigger or cause their migraine headache, including caffeine or red wine, MSG, stress, or a change in weather. The priority care is pain management, and we're going to talk about different types of drugs, either abortive drugs or preventative drugs. So preventative drugs are taken on a regular basis to prevent the migraine, where abortive drugs are taken once the migraine has started to stop the migraine. Migraines fall into 3 categories: migraines with an aura, without an aura, or atypical migraines. An aura is a sensation, or usually a visual change, that signals the onset of a headache or seizure that occurs immediately before a migraine. The patient may talk about seeing flashes of lights or other types of visual changes or disturbances that are classified as an aura prior to the migraine starting. The majority of migraines are without auras, and less common is the atypical migraine, which occurs in clusters or in relation to a menstrual cycle. The stages of migraines include prodromal. The prodromal phase is the one in which the patient has specific symptoms, such as food cravings or mood changes. The aura phase, which generally involves visual changes such as flashing lights or diplopia, which is double vision, may also occur for certain patients. The headache phase may last a few hours to a few days. The termination phase is the phase in which the intensity of the headache decreases. In the post-prodrome phase, the patient is often fatigued, may be irritable, and has muscle pain. Diagnosis of a migraine headache is based on the patient's history and on physical, neurologic, and psychological assessment findings. The typical migraine is described again as unilateral, being on one side, frontal temporal, throbbing pain that is often worse behind one eye or ear. It is often accompanied by sensitive scalp, anorexia, photophobia, and phonophobia. Phonophobia being sensitivity to noise, photophobia being sensitivity to light. The patient may also experience nausea with or without vomiting. Patients tend to have the same signs and symptoms each time they have a migraine headache. Go ahead and pause the video and review chart 42.6 on page 874. The priority for patients who are experiencing migraines is pain management. So we talked about before, there's 2 types: abortive therapy and preventative therapy. Abortive therapy is aimed at alleviating pain during the aura phase or soon after the headache started. So this, if you think about those of us who don't have migraines, if you think about when you normally have a headache, you take medicine once you have the pain in your head that you want to alleviate. That's abortive pain, to stop something that's already started. If the migraine is mild, the patient can treat it with acetaminophen, NSAIDs. Excedrin's a brand name, but a medication that has caffeine in it can help also. Severe migraines can be treated with prescription medications. So the first classification of medications we're going to talk about is triptans. Triptans relieve headache and associated symptoms by activating the serotonin receptors on the cranial arteries, the basilar artery, and the blood vessels of the dura mater to produce a vasoconstrictive effect. So this makes sense, right? If the problem with the migraine is vasodilation and inflammation, a medication that causes vasoconstriction would be helpful. Your prototype is sumatriptan, but you really just need to recognize triptan and associate it with the vasoconstrictive properties that are used to treat migraines. Teach patients taking triptan drugs to take them as soon as migraine symptoms develop. Instruct the patient to report angina or any chest discomfort immediately to prevent cardiac damage from myocardial ischemia. Remind them to use contraception, birth control, while taking the drugs because the drug may not be safe for women who are pregnant. Teach them to expect common side effects that include flushing, tingling, and a hot sensation. These annoying sensations tend to subside after the patient's body gets used to the drug. Triptan drugs should not be taken with SSRI, antidepressants, or St. John's wort. Ergotamine derivatives are also used to treat migraines, and you can notice here Keftogod is your prototype and it has ERGOT within it, right? So that's your clue that it's an ergotamine derivative. Also, DHE is given frequently in the hospital setting through IV. Midodrine is another medication that is used that is a combination drug that it can be used to treat migraines. It is an option when the ergotamine preparations are not tolerated or do not work well. So we've talked about abortive therapy. Those are the medications that the patient will take once the headache has started. Now we're going to talk about preventative therapy. These are medications the patients will take regularly to prevent migraines. Used when migraines occur more than 2 times per week, interfere with ADLs, or are not relieved with acute treatment. So the first classification is good old NSAIDs. They can be taken regularly to help prevent migraines. Propranolol and timolol are the only 2 beta blockers that would be prescribed as preventative therapy for a migraine. Again, you recognize the LOLs as beta blockers. Verapamil is a calcium channel blocker prescribed for migraines. The calcium channel and beta blockers are thought to reduce the activity of hyperexcitable neurons and act on the neurogenic cause of the migraines. And then if you remember how these 2 classifications also affect blood vessels, both calcium channel blockers and beta blockers interfere with vasodilation, a contributing cause of migraine pain. Since beta blockers and calcium channel blockers will decrease blood pressure and heart rate, we want to make sure that the patient is monitoring their blood pressure and heart rate at home and encourage them to report any bradycardia or adverse reactions such as fatigue or shortness of breath to the healthcare provider as soon as possible. Topiramate is one of the most common anti-epileptic drugs or anti-seizure medications that's used for migraines. When used for migraines, it's prescribed at a lower dose. The exact mechanism of action isn't clear, but this drug may inhibit the sodium channels that may be hyperexcitable in patients with a migraine. Nortriptyline is a tricyclic antidepressant that is often effective as a drug to prevent or reduce migraine episodes. Side effects include dry mouth, urinary retention, and constipation. The drug is not used for older adults because it can cause delirium or acute confusion. Botox is another therapy that is approved for the use in adults, which can help to prevent migraines in the patient who chronically suffers from migraines. In addition to drug therapy, trigger avoidance and management are important interventions for preventing migraine headaches. And there are a lot of things that have been identified as triggers for migraines. They include alcoholic beverages, aged cheese or other foods with tyramine, caffeine, chocolate, foods with yeast such as pastries and fresh breads, MSG, nitrates found in processed meats, pickled or fermented foods, nuts, artificial sweeteners, and smoked fish. Certain drugs are also associated with migraines, including cimetidine, estrogens, nitroglycerin, and nifedipine. Other factors that people have identified as triggers for their migraines include stress, anger, conflict, fatigue, hormonal fluctuations, light glare, missed meals or hypoglycemia. We already said stress, sleep problems, smells such as tobacco smoke, and traveling to different altitudes. An external trigeminal nerve stimulator is a wearable headband that stimulates several branches of the trigeminal nerve that are associated with migraine attacks and pain. Teach the patient to use the device no more than 20 minutes a day as recommended by its manufacturer. Other therapies used to treat chronic migraines include yoga, meditation, massage, and biofeedback, vitamin B12 and magnesium supplements, acupuncture and acupressure, as well as trigeminal nerve resection.